Hello, I'm Janet Cleveland, Deputy Director for Prevention Programs in the CDC's Division of HIV and AIDS Prevention. To pursue the goals of the National HIV and AIDS Strategy, prevention programs in the African American community for gay and bisexual men are very important. Guided by the National HIV and AIDS Strategy, the CDC is pursuing what is called high-impact prevention. By 2015, objectives include reducing new HIV infections by 25%, increasing the proportion of newly diagnosed patients linked to clinical care within 3 months of their HIV diagnosis from 65% to 85%, and increasing the proportion of HIV-diagnosed gay and bisexual men with undetectable viral load by 20%. African Americans face a number of challenges that contribute to the higher rates of HIV infection in their communities. Today, nearly a quarter of African American families live in poverty, which means more limited access to high-quality health care, housing, and HIV prevention education, both directly and indirectly increasing the risk for HIV infection. Health inequities are still a problem in the United States. A recent report by the Centers for Disease Control and Prevention showed that African Americans accounted for 44% of all new HIV infections in 2010, despite making up only 14% of the population. Young Black men, particularly our gay and bisexual youth, account for more new infections than any other group in this country. The stigma and homophobia that is far too prevalent in so many communities continues to prevent too many African Americans from having authentic discussions about HIV and seeking testing, treatment, and support. We must work on greater community accessibility to the prevention programs from the CDC. This access may be fostered by using web-based trainings. CDC has developed resources and materials for community-based organizations to implement numerous HIV prevention interventions that are proven to be effective. However, use of those resources requires training. Training ensures that the interventions are implemented in the way they are supposed to be so that they will still be effective. To successfully diffuse these interventions in order to achieve the greatest impact possible, trainings have to be accessible to the intended audience, but also must be scaled up to ensure that the intervention is being implemented among the most impacted persons in the most impacted areas. Improving access to these proven interventions is the reason why we have increased the number of programs that have web-based trainings, which are more easily accessed than traditional face-to-face trainings. Behavioral interventions that are created by the community for the community have proven to have greater influence and acceptance. DUP was created in response to the need for more culturally targeted HIV prevention approaches for African American gay and bisexual men. Having communities define and direct efforts to combat HIV is empowering as they take the lead in HIV prevention in their communities. Once communities have the available tools, they can take the necessary action to improve the health of their communities. Thus, CDC is pleased to provide web-based trainings so that more members of the community can be trained in how to use those learning tools correctly. DUP is a program created by and for the African American community, but requires training to implement correctly. The focus of DUP is on brothers keeping brothers safe. Opinion leaders are the agents of change to promote safer sexual practices among their friends. The idea is that people are more likely to listen to messages from those who are close to them and respected. The more of these discussions that take place, the more prevention messages spread throughout the community, contributing to behavior change that reduces the spread of HIV.